Greetings from eMedi News and Heart Care Foundation of India. Welcome to our show, Chat with Dr. KK. Today we have with us Dr. Dev Pehlajani, who is past president of Cardiological Society of India and also past president of Indian Association of Physicians. He's an interventional cardiologist par excellence at Mumbai-based Breach Candy Hospital. Welcome to our show.
Thank you very much, KK.
In India, we have approximately 10 to 15% people who suffer from coronary artery disease. If you go to the Kerala, it may be 14%, somewhere it may be 10%. Huge population who is having coronary artery disease. A large number of them, say around 7 to 8% of them, may end up into a ischemic pain like angina, heart pain, or heart attack if they occur. So chest pain in them is a very, very, very important subject. So we are going to focus our discussion on how to differentiate a heart attack from angina, how to diagnose a heart attack, and when to say it is a medical emergency or not. So if a person comes to you or in an emergency room with a chest pain, what should be the role of a family physician? How we should be able to differentiate that he is not missing a heart attack?
KK, is very, very important for somebody to identify a chest pain which is possibly due to the heart attack, or what in medical terminology we call it as a myocardial infarction. And many times, unfortunately, this chest pain, which is due to myocardial infarction or due to the blockage in the coronary arteries, is misdiagnosed or sort of ignored as a gas pain. And I always tell jokingly a small sort of a citation or something which I read in the book on angina pectoris, that the graveyard is full of people who died of gas trouble. So I think my warning to people is that when you get a chest pain for the first time, or your patient to the doctors, I would say, if your patient who's an adult patient, especially a male patient who's above the age of 45 or 50, gets first time chest pain in his life, and especially if the pain is located in the center of the chest, what one calls as the substernal area, one should not ignore this pain. Particularly if this pain radiates to the shoulders, goes to the arms, goes to the jaw, goes to the back, and it's like a squeezing pain or some pain which is like a pressure on the chest, should be taken up very seriously and would need a further evaluation.
Can I take it as that any discomfort, pain, burning, acidity attack, or abdominal fullness appearing for the first time in life after the age of 40, which is not unexplained, which cannot be explained, first rule out heart attack?
Absolutely.
That means first attack of acidity after the age of 40, rule out heart attack.
There's something which is very unusual for the patient that he has never complained. Even as you said, acidity. Say, for example, the patient has been eating well and never had an acidity pain. For the first time, he lands up in doctor's office or goes to the emergency medical services department, and he says, I got an acidity pain, a burning pain in the upper abdomen. Of course, other causes have to be ruled out. But a very important
heart attack should also be ruled out. So anything unexplained, anything for the first time, anything which is unusual.
Absolutely.
Which is unusual.
Right.
Okay.
The other thing is that many times the heart attack might have come as an acute pain. But if you take a careful history as a doctor, and if he gives a history for last few days, he says, I've been walking and getting some discomfort in the chest, or after eating meals, I've been getting substernal or the chest pain or pain in the arms or shoulders. Or he says, for last few days I've been sleeping and I don't feel comfortable. I get something in the chest, I have to wake up, sit up. Then once I sit up, I go back, I feel nothing in the morning. Take it seriously.
So the warning always comes.
Always.
Invariably. In how many percentage of cases a person may get directly a heart attack without a warning?
Well, I would feel that 50 to 60% patients get a heart attack without warning. And the first time they land up is in emergency medical services, and then you see that they got heart attack or a myocardial infarction. But in many of them, you do see patients who get this kind of a warning symptom.
The only thing you don't want to miss in a patient with chest pain is dissection of aorta, that is the rupture of the artery, the main artery which is supplying blood to the brain, You don't want to miss. And also you don't want to miss is a clot from the leg going into the
Well,
lungs.
especially KK is a patient, say for example, an executive who has gone on who came back from a long journey, traveling in the plane, and then he says that I'm getting breathlessness, I'm getting chest pain. Don't forget to ask him whether he had some pain in the legs, because it is quite possible after a long journey they develop what we call as a DVT, deep vein thrombosis in the legs, and that clot goes from the legs into the lungs and causes that pain. And many times you find his EKG or ECG may be normal, but keep an index of suspicion very high. Ask a history whether he had that long journey, whether he's getting pain in the calf muscles from where the clot might have gone. So don't forget to rule out a pulmonary embolism also in such a patient.
Does the symptoms of heart attack differ in men and women? We say that women it is more atypical, and in women because we say it because the mortality and morbidity are higher. What are the symptoms in a women?
Like many times in the woman, the pain may not be classical, very classical in the substernal area. Sometimes it may be on the left parasternal area. Sometimes the pain may be more like a pricking pain, and the pain may be a little bit more diffuse pain in these females. And many times women may not give you a history that they got the pain on walking, because many of the women are little sedentary. They are not more active like men who keep on going to the gym, or they walk and they climb up and down staircases that the pain can get unmasked. In many of them, the pain can remain sort of dormant for some time, and so therefore the pain may not be very, very evidently like a cardiac pain in these patients. Sometimes they get fatigued, they feel that they don't feel too good, and these are very
atypical symptoms.
Atypical symptoms.
What about people who are 80 plus?
Who are
80 plus.
80 plus. In them also you see that sometimes the pain may not be like a typical substernal pain, because again these are the people who are sedentary. 80 plus people are more at the home, and they get more breathlessness rather than a severe chest pain. The reason being, most of them have got a very diffuse disease, and because of the diffuse disease, when they get a heart attack, the left ventricle fails. So they get more breathless, they get rales in the lungs, and many times in these patients, the symptoms are sort of attributed to some chest infection, because he's an old man, gets a chest infection. Some people feel, okay, he's got something like a bronchitis, and he's got an allergy. So in such patients, even if they get breathlessness or cough, do not forget to rule out that this may be because of the left ventricular failure that they got because of the ischemic heart disease.
What is the youngest patient you've seen with acute heart attack?
Oh, the youngest patient that I've seen is about 16 years, young boy.
Any reason, or it's a...
Yeah, I think that patient, I remember he was in our Sion hospital where I was a professor of cardiology. He had a nephrotic syndrome. And as a result of nephrotic syndrome, nephrotic syndrome is a problem with the kidneys where they get a lot of proteinuria, and because of that they get a very high cholesterol also. His cholesterol was in the range of about 350 or 400 milligrams, and he had an anterior wall myocardial infarction.
So to pick up such cases, at what age the first cholesterol should be checked up?
I would feel that the cholesterol checking, routinely speaking, I think one should check at least from 30 years of age. Because one thing one must remember, we always have been teaching people that the prevention must start from childhood. Because ultimately atherosclerosis does not start very late in life. It starts from actually early childhood. So if you say that I'm going to pick up cholesterol right from childhood, it's probably sort of not a very wise thing, because then we will be subjecting so many people to cholesterol checking in the childhood.
At the age of 30, you must
30, I would feel 30 should be the reasonable figure.
Okay.
Some executive checkups, people will say 40 years. But I feel 30 should be.
If a person comes with chest pain and his ECG is classic and he has a classic pain, do I still need to have enzymes, because tests like TROP-I are a little bit costly?
Well, I would feel that if you do a TROP-T, TROP-I, and TROP-I, as you know, is quantitative. TROP-T is qualitative. And CPK-MB is again gives us the extent of myocardial necrosis. I would feel that even if there are ST elevations, you find that the patient has got signs of myocardial infarction, I would like to do these tests. The reason is I'm going to subsequently follow this patient. If I find that the serum enzymes are going up. I know that
You know, to see the response of the
you
treatment.
want to see the
Come
response.
back to other than the topic. What are your hobbies?
Oh, my hobbies. I am very fond of Hindi, old Hindi music. As a matter of fact, you'll be surprised. I can sing also.
Doesn't look like.
Yeah, I know. I'm very
2 minutes. Give me 2 lines. Give me 2 lines.
You want me
Yes,
to
on
give
the
you?
God, 2 lines, absolutely.
Okay, all right. Give you 2 lines. आपके हसीन रुख पे आज नया नूर है मेरा दिल मचल गया तो मेरा क्या कसूर है.
So, do you feel that people who sing, they get less heart attacks?
I think so.
And people who listen and absorbed into it also get less heart
Also
attacks?
get, because they
So
are
because
all,
music is healing.
yeah, they are all in the waves, you know,
Now,
waves
I
of
just want
eternity.
I just want to add something in music, that whenever I get a physical pain, the sound which will come will be a vowel. Ah, e, u, a, ouch.
Right,
And vowel chanting produces interleukin 2.
right.
Whenever I weep, I produce a sound which is nasal consonant. Ma, na, ga, na, na.
Yeah.
Na, ga, These are weeping sounds. And weeping sounds produces delta activity in the brain. So om chanting, chanting, im chanting, chanting, hum chanting, amin, amin, they all produces interleukin 2 and tranquilizers. Therefore, they are healing sounds. And also, if I reduce my respiratory rate during singing, I go to parasympathetic mode. And if I increase my respiratory rate, I go to sympathetic mode. So, Ati Kya Khandala is a sympathetic stimulant. E Malik Tere Bande Hum produces parasympathetic. So, music is a
Yeah,
cardiology prescription.
right. It is very relaxing. I can tell you.
You feel that if you would not have been a cardiologist, you would have been a singer?
I don't know what you listened just now. So if you
what I'm
feel
saying.
my
That's what I'm
sound,
saying.
my voice was good, maybe I would have been a singer. I don't know, but that depends upon the listeners if they felt that it was good.
If the Prime Minister of India calls you
Yeah,
and asks you to become a health minister for a day,
yeah.
what will you do as a policy change, major policy change?
I think that's a very good question. I think I will do at least 2 things. Number one, I will see that the sanitation and the water supply to the villages and the cleanliness.
So that is sanitation.
That
So one,
is
you will work on sanitation.
Sanitation and water supply. I think cleanliness
And
will
water supply.
and,
Safe water
that will
supply.
reduce the infections. It will reduce the.
So sanitation and safe water
Yeah.
supply.
The second thing I would feel that today, I'm a cardiologist, so maybe my whole thing is biased, but I see the figures of the coronary artery disease deaths in the country, and I'm sure you are also aware. You have been writing, you have been putting it on the net. You're creating a lot of public awareness. That the 33% of the deaths in this country in the adult population are due to coronary artery disease. That's the most productive segment of our society. And our Prime Minister is a finance man. So if he wants to increase the finances of this country,
He must
he
take care
should
of that.
see that this segment of the people is taken care of. And that people above the age of 40 is the most productive period of our life. So if he wants to increase the finances, he and our finance minister see that a lot of funds are diverted to this. If I was health minister, I will force him
Absolutely.
to divert these funds
So
to,
if,
to cardiology.
When you talk about so many deaths in India, one is prevention, but second is that if it happens, the public must be taught hands-only CPR.
Yeah.
That within 10 minutes of clinical death,
Yes.
for the next 10 minutes, they should be able to do 10 into 10, 100 compressions per minute.
Right.
So do you feel that should become like lot
should
of
be a-
awareness must be there to teach them?
You can't be more right than this. I can tell you that this is there should be public awareness, and there should be out of hospital resuscitation done by the lay public. I think the people in every lane, every office, there should be some people who should be designated to teach how to do a CPR.
So at the end, let me come back to fun. And the fun is that I listened to once Shadruvan Sinha, and he says he's the most misspelled person in the earth. Whenever he goes to people spell him differently, talk about him differently. And I also heard you many times that people, when they talk to you, that you have started talking yourself as Dr. Dev. You don't want your surname to be spelled, because most of the people spell differently. Just for the fun, how do different people try to spell you out?
Well, I will tell you, KK. Right from beginning, my name is last name is Pahlajani, Pahlajani, right? It's very simple, and that the Pahlaj has come from Prahalad. And in Sindhis, we don't have a Jor Shabd, like Shakti. We don't have Jor Shabd. Okay, so Prahalad is a Jor Shabd, Raha is a Jor Shabd. So we say Pahlaj. Prahalad is pronounced as Pahlaj. My grandfather's name was Pahlaj Rai. From there, our surname has come as Pahlajani. But somehow the people who hear my surname, they either misspell or mispronounce. I'll give you some example. Somebody call me Pahlajani. Simple. Very simple. I could tolerate that. Somebody used to call me Pailajani. Somebody call me Paglajani. And to top it off, somebody called me Palwanji. And spelling, nobody has spelled my name correctly, including the income tax people. And I'm very happy, because then the demand goes to somebody else. But somehow they got my PAN number. So that's why the demand again rebounces back to me. Somebody spells my name Pahi. Somebody says Paha. Then somebody says Pahlajan. So I is missing from the end. So you can imagine hundreds, but only thing is that somebody in America, when I talked to my boss, I told him I want to join your department. He said, please tell me the spelling of your name. So I gave him the spelling of my name. Believe you me, in 2 years of fellowship that I spent with him, I never heard him mispronouncing my name or misspelling my name.
So the message is very clear. Though it was a part of fun, but it's an etiquette that when you are talking to anybody, and that etiquette very clearly is never spell a person's name wrong, and never spell or pronounce a person's name wrong, but it hurts, because his identity is lost if you spell him wrong, or if you write his name with a different spelling. So that's all for today. Let's thank our guest,
Thank you very much.
I'll call you as Dev.